my Facebook Live media. My computer is dead, so I'm gonna have to get go somewhere else. Make this brief. There are other clinics out there. I just had another clinic I was doing research on from the Tampa Bay Times, which Bridgewater in Montana was able to get the same, had issues getting Title X funding because of the political lobbying that was going on with their state, as well as issues with private clinics versus bigger, larger clinics like Planned Parenthood getting more access to grants, Title X funding, this smaller clinics like Bridgewater. But in the state of Montana, Bridgewater was actually able to win the state's entire win the program designed to get access for family health care services, which is something good that also Planned Parenthood does provide. Okay, so that is a great opportunity. Unfortunately, a lot of other clinics, not just necessarily being debated before the Supreme Court right now. Ugly. My computer is dead. So a lot of other clinics too. I know I'm kind of in a city right now. A lot of other clinics are going to be losing their federal funding. It's not just necessarily abortion clinics, but family health care services clinics going to be losing their federal funding grants because of the way how Title X funding works. And right now, Title X is also on the table for the Supreme Court to be debated right now. It's Title X as well as Title 12 for National Department of Education, which is also, like I said before, I've also, been talking with students at Harvard University here in the city of Boston about how important the issues are going before the Supreme Court right now in Washington, D.C. And Title X as well as Title 12 is a huge big topic that covers organizations and departments and health departments, organizations all across the United States and the world, okay? How federal funding and budgeting works, okay? If you take away organizations funding, you take away that ability for that organization to survive. So it's not just necessarily Planned Parenthood that is going to be losing their Title X funding. It is also sister clinics as other clinics that provide alternatives, okay, that provide alternatives to Planned Parenthood that are not going to survive what the Supreme Court is doing right now. Okay, so that issue is being debated right now before whatever. That issue is being debated right now before Samuel Alito, Supreme Court Justice Samuel Alito, and the other 8-9 justices on the bar. So, like I said before, family planning clinics were offered as an alternative to Planned Parenthood. Okay, so this is LaQueen battle. I don't have any alternatives. I am a certified medical assistant. I just have to go ahead and work on my certification this year. I do first aid, adult pediatric first aid. I also do security. I also do public safety. I also do research on terrorism. I'm also a mother. I'm a sister. I'm a daughter. I'm a friend. I'm also a community advocate. And I'm a lobbyist, okay? So I'm not the organizer like the Starbucks Amazon guy, but I'm your own face-to-face social media person that you see pretty much all the time on social media. So right now what's being debated before the United States Supreme Court is not just Planned Parenthood. It is Title X funding, okay? Title X funding is going to affect family planning clinics as well as all these other healthcare service providers, which of course has affected the city of Boston, okay? Here's one example. Tufts Medical Hospital, okay, has just recently closed down its children's medical unit, okay? So Tufts Hospital, a major hospital in the city of Boston, has decided to close down its children's unit because of a lack of donations as well as population control, and the ability, not the ability to get in patients there to be treated. So Tufts University Hospital has been a casualty of a lack of funding. Okay, Tufts University Hospital. So that's another example. So you think it's just clinics, you think it's just sexual clinics, you think it's just abortion clinics. It's more than just abortion clinics. It's more than just family care clinics. It's also hospitals and healthcare administrators on a whole wide scale. Okay, people do not understand that. They think it's all about abortion. Abortion is just a healthcare service. Abortion is more than just that. It's also affecting women as well as people out there that need to get assistance to medical services. Okay, and this has also been an issue during the pandemic. People were lost because they did not know where to go to get assistance for COVID. Okay, there was so much disinformation out there. Where I go, who do I talk to about COVID-19? Okay, so much disinformation out there. So there is a loss. There's going to be a loss of federal funding. There's going to be a loss of federal funding. Okay, when this if the Supreme Court law is passed. Okay, and I do need to do more research on that too as well. So I just wanted to come by with you guys and just explain it a little bit more about it. Okay. I've been a medical assistant. I've done the clinical side as well as the administrative side. And usually the administrative side is a little bit more actively involved, where you have to get into the patient billing, you have to get into the patient history, you have to know their medical history, their medical background, why are they coming into this clinic, their family history, what are they doing, have they been exposed before to this STD, what kind of community do they live in, how many kids do they have, does their mom or their father have a history of cancer, has this happened before, have they been a victim of crime, have they been a victim of assault, do they have a history of criminal behavior, whatever it is, a lot more is involved in it instead of just the sexual reproductive health fact. You also have to factor in the person's own personal history, as well as their mental and their physical health involved in the whole process of why you're coming to be seen in that clinic. Okay, so it's just a little bit more than just abortion, okay, or family healthcare services. And if people actually consider not just Planned Parenthood, but also the sister umbrella clinics, as well as all the other healthcare organizations that are going to be affected when this Supreme Court law, okay, is being debated to defund it. Okay, it's already been defunded. Now they're trying to take away the law of the whole entire establishment of it. Debate, terrible debate. So I do understand a lot of people have disagreements about what I'm saying right now, and a lot of people say, okay, I don't know what I'm talking about, I need help. I do completely understand that, but let me tell you how it is, okay? If you take away something, then you need to have an alternative in its place, okay? That's how it works, especially with politics. You take away something, you have something in its place to fulfill what has been left behind, especially in the community, okay? Now, you take away a clinic in the Black community, what is going to come in the Black community to replace that clinic? Most of the time, if a clinic is taken away in the Black community, usually what comes in the Black community to replace that clinic is either a business or a convenience store or some kind of retail store that has to fill up that space that clinic has left behind. Okay, that clinic has been there for years, 20, 30, 40, 50 years, and no doctor or nobody else can come in here and fulfill that space and the history that clinic has left behind. Okay, now if the clinic does come in and takes over the lease that clinic has left behind, then that clinic also has to take on the loans that the old clinic has also been dealt with too as well. So there's also lobbying as well on that too. Okay. So like I said before, if you take away one clinic in a community, you have to have another clinic or another healthcare system to come in there and replace it. Usually, also, if a clinic, a small clinic or a community of clinics is taken away, then you build a hospital, or they refer you to another clinic, which is usually a couple miles away or in another part of the city. Okay, and it takes away the services that are needed for that small knit community. Okay, in my personal situation, okay, in the South Side Chicago, in Dallas, in Los Angeles, in San Francisco, in New York, in Seattle, there were clinics that were there available, but these clinics were in the low income, highly exposed areas. Okay, the clinic was shut down. Okay, they shut down the clinic, and so people that needed the services from that clinic had to be referred to the emergency room department of the hospital. Okay, or had to go on the waiting list to get services in the hospital. Okay, and usually hospital organizations and hospital systems are overburdened. Okay, with waiting lists for patients who need emergency assistance right then and there. Okay, I need HIV testing right then and there. Okay, I need to be tested for HIV testing right then and there. I need the morning after pill right then and there. Okay, I need services right here and there. Okay, I cannot wait 6 weeks to get an appointment at a hospital. I cannot wait 6 minutes to get an appointment at a doctor's office. Okay, because the clinic right down the street has been closed down. So now I have to wait 6 months, 3 months for an appointment at a doctor's office. Okay, because my clinic has just been defunded. You see how that works? Or they closed down the clinic in my community because the doctor died, or they moved, or they lost their license. Okay. So now that person who needs emergency assistance, emergency medical services, has to wait 2 to 3 months to be seen by a physician or a nurse practitioner. Okay, and therefore they usually they schedule an appointment or they go to the emergency department. Okay, and they have to go through the whole procedure of going to the emergency department. Okay, sometimes they get services in the emergency department, sometimes they don't. Okay. Usually at the emergency department, there's privacy, but in my personal situations, I have not received privacy at emergency departments. Okay, sometimes I have, sometimes I haven't. It's just that's how it is. Okay. So you're defunding clinics, healthcare clinics, and family planning services clinics around the world, around the United States. You're taking away Title X funding for these clinics that provide community services for young people, for adults, for mothers with children, for women with history of cancer, for elderly adults, and even elderly adults have high cases of HIV and STDs as well in the elderly. Okay, so you also are taking away HIV and STD services for the elderly too. You'd be surprised how much gonorrhea and chlamydia is in the elderly over 65. Okay, so anyway, that's pretty much what is going on. Okay, so they're going to be taking away that funding. Okay, now there's a lot of it. The article was in the Tampa Bay Times. I'm going to send a link to the article on my Facebook page as well as to my Instagram page for you guys to read it, and then you can refer and go from there too as well. Okay. Again, they're going to be taking away that Title X funding, which is very detrimental to clinics around the world. Okay. Now, I think it's I think it's, it's great for somebody to have the availability to plan for your own family. I think it is amazing, an opportunity, okay, for you to have the option to say, I want to choose how I want my life to live. Whether it's, doing family planning, or whether you can continue living your own lifestyle, however you want to live it, or whether, you are in a situation where you decide that the family planning method is not right for you, and you want to proceed with the morning after pill, whatever works, or any kind of contraceptive method. Okay, whatever method works for you is your personal decision. But it's your personal decision. Okay, that's what should be made. It shouldn't be debated. Your personal decision should not be debated before anyone else but between you and your primary care physician. Okay, as well as if you are in an abusive situation. If you are in an abusive situation, okay, and you are forced to abide by whatever is in your community, the laws in your community, you need to have resources available to you to look out to it, to say, what can I do in order to get the assistance that I need to take care for me, my personal health, okay, and my own health and well-being, okay, especially if it's in your own community set, okay. Sometimes it could be a religious community, sometimes it could be a cultural community, or you're all the same age, or sometimes it could be a community of family members where they have certain rules and regulations where they do not allow for you to do what you're doing, or they do not allow for you to go to this certain place and to get services here. Okay, they want you to talk to them and they want to go about it doing things their own way. Okay. Whatever it is, it's your personal choice, whether you're a male or a female. It's or any other kind of intersex, any other kind of gender. It's your personal decision of what you want to make. Okay? It shouldn't be debated between anybody else but between you and your provider. Okay? Now a lot of people are politicizing Planned Parenthood, or taking it way too far. They are forgetting the mission of Planned Parenthood. The mission of Planned Parenthood is to go out there and provide services to the community to help alleviate, to decrease rates of infection in the community. If they really thought about decreasing rates of sexual infection in the community, maybe they would provide more funding towards services of HIV and STD counseling services and testing services. But so far, increasing funding for STD and HIV sexual services are not being provided or not being made. Okay? So the funding is not going there. Instead, the funding is going towards other things that is being lobbied before in the House right now. Okay? The United States still needs community healthcare services. Okay? College students, as well as elderly senior communities, senior apartment buildings, elderly communities need healthcare services, healthcare centers as well, even if you're over the age of 65. You still need to be tested for age and STDs. You still need to be tested. They do not talk about that, but you still need to be tested as well. Please do not take away that mission. Do not forget the mission of these organizations, as well as even if it's not Planned Parenthood, do not forget the mission of the community service organizations that are out there, okay, that are saying we will do what's best, okay, to provide services in absence or in existence, in place for, okay, for the community. So I hope you guys can understand that. Okay, I know I think I just set my computer down. Okay. please do not take away that recommendation. Unfortunately, a lot of community service clinics, Southside Chicago, Los Angeles, New York, and even here in Boston have lost funding just for being a community clinic. It's sad, okay? Even here in Boston, on Mass and Cass, they have lost a lot of community clinics have lost funding. They have not been able to survive because of the misorganization of management, or as well as just because of lack of federal funding. That they really need to provide testing for services for people, not just women, but drug and alcohol addiction, which is also a major factor that needs to be talked about before Congress too as well. How are we going to talk about drug and alcohol addiction too? Okay, so that's also another issue that needs to be so my computer is shut down here. Okay. I'm glad I was able to talk to you guys about today abortion, birth control, family planning, and of course the closure of clinics in Boston, which is a major hub for healthcare. And it is very surprising to know that Tufts Medical Hospital was lost its children's clinic, which is really sad to say during this pandemic, that Tufts did lose its children's facility. So unfortunately, that's how it is. But we only can do what's best for us. Okay. Still continue to advocate for these hospitals and these clinics out there to say we continue to support the services that you provide, but we do not support other services that you provide. So what can we do as an alternative or as a substitute to remedy and to make sure that you still receive funding, but what can we provide an alternative to, or what can be a substitute for that? And right now, they're taking away the alternative and they're taking away the substitute. So what is left for this new generation of young people and our older generation who are receiving rates of STDs and hepatitis C in the city of Boston? Right now, the rates of hepatitis C is at its highest in kids. Hepatitis C in kids. Horrible. So how are these kids going to be tested for hepatitis C? They have to go to community clinics and children's hospitals. Well, the community clinics are shut down. What are they going to do? Okay? So we have to figure out what is the best way and what is the best method to help to make sure that these organizations are still in existence. What can we do to best support these businesses? Okay? All right, it's sad to know about Tufts Medical Hospital. It's sad, but you can do what you best can do. All right? Okay, so this is LaQueen Battle First Aid Responder Services. It's Wednesday, a beautiful day here in the city of, here in Massachusetts, at a school. Very happy to be here with you guys talking. Hopefully I can share more with you guys about what's going on and do more. All right? God bless you all and take care.